What's up guys, Dr. Aaron McEnroe here with Revival Performance Physical Therapy, and today we're showing you guys an exercise to strengthen the wrist. So it's going to be all four directions of the wrist. So it's going to be wrist extension, just kind of going back this way, wrist flexion like this, wrist ulnar deviation, and wrist radial deviation. So not as much motion on these ulnar and radial, especially with the radial, just because of the way the anatomy is in the joint. But what we're going to be doing on this is we're going to be using a TheraBand to go in each of those directions. So this is going to be the resistance, and we're just going to resist into each of those directions. So I'll show you how to do that right here. So I think it's a little bit easier to just have it sitting so that you can kind of rest your arm in one place, so you're not having to use your shoulder muscles as much, but it's okay to do it up like this if you want to. So put this TheraBand, I'd make a fist like this, but you could have your arm or your hand straight if needed. And so I'll make a fist here, and then my wrist is just in a neutral position here, and I'm just gonna control that this way and then control it back. So try to go in full range of motion, meaning you're going as far as you can one way and as far as you can the other way without it slipping off like this. So try to get as full range of motion as possible, but not into any pain. So say it hurts right there, and every bit further hurts even worse, then just stop right before you get to that pain and just stick with that for now. So this is wrist extension, so doing the prescribed amount there. Then we'll go into wrist flexion. So this one's easier if you're just holding it like this, or you can use like a little dumbbell as well, and you're just controlling that up just like that. So the wrist is pointing up, and you're letting it go all the way down as far as you feel like you can control, but not completely resting there, and then controlling it back up. Again, you can do that with your hand straight or with your hand in a fist. You can also keep it there for radial deviation, so that's just going just like this. So in this radial deviation, so your palm is facing towards the middle, and the back of your hand is pointing away from you, and then you're controlling that. So notice I'm not like just moving it all around. You want this mostly pretty straight like this, but it can be in a little bit of extension, so it's more in that neutral position. So like when you make a fist, you notice it's a little bit of extension there. It can be in that position as you're doing that radial deviation, or it can be straight up and down like that. So straight like this, or in a little bit of extension like that. So all these shouldn't hurt. And then this last one is going to be ulnar deviation. So this is your ulna, and so you're deviating your hand towards that. So you're going to be here, and then just pushing it towards that. So ulnar deviation. Controlling that each direction. If you want, you can do it with the fist. Again, just like that. Controlling that position as full range of motion as you can. Resisting with the band. Do the prescribed amount. Have fun.